Welcome to Doc Talk with your host, Brent Lovett. And Doc Talk with Brent is sponsored by Battleborn Financial.
Hi, welcome to Doc Talk with Brent Levitt. I am the owner of Battleborn Financial Advisor and health insurance broker here in Pahrump, and we help people with their finances and also help with taking care of their healthcare needs. We started this show to talk to primary care doctors here and talk about the needs that Pahrump has with regards to getting medical care. I'm joined today with Dr. Marianne Hazlett, who's been happy to be our first guest and first victim on the show. She is a wonderful primary care doctor here in town. Her office is located on the corner of Homestead and 160 in that little area. She has been practicing here for just a few years, and she's actually a local, which is super awesome. That we love people who actually want to build practices here in Pahrump and be out here. So want to say anything? Welcome to the show.
Thank you, Brent. This is great being here with you. When I was at the hospital working as a hospitalist for a couple of years, and when I decided to open a practice, I didn't want to drive to Vegas every day. So, I decided to move out here so I could be local and be close by. Better take care of people that way.
And yeah, you're not here, but you also have your parents here too. So, I mean, your roots are pretty deep.
Yes, mom and dad moved out as well. They had to be close, so they live down the street.
And the coolest thing, I want to talk first a little bit today about, I've been listening to a lot of podcasts and news sources about how healthcare usage has really declined quite a bit. And I think we're all in the same boat with this whole COVID stuff, things like that. It's like we're a little bit afraid to go see our doctor, our primary care doctor, and which is good and bad. The fact that it's nice that we're not utilizing services we probably don't need all the time, but at the same time, we're not getting the care that we need, and we're allowing ourselves to become sicker because of that. Dr. Hazlett is actually taking new patients, which is phenomenal. And her appointment times are pretty easy to get into. And I'm going to say also, it is really safe to see a primary care doctor right now. And in fact, it's important to see a doctor. And in order to see her, a lot of our Medicare plans that she takes, for instance, like Humana, she takes the Humana Gold Plus plan. She takes the Humana PPO plans. And right now, even like Humana, some of the carriers that she takes, like even Health Plan Nevada you take as well.
Yes.
Some of the carriers are actually, if you see your primary care doctor, they're waiving all your copays right now. They want you to see your doctors, even though you're thinking, man, it's dangerous to be out there, might get sick. But the doctor's offices are really safe places to be. They're cleaning up after themselves, they're wearing masks, and you're going to be able to get taken care of, especially if you have something chronic going on. Do you want to say something more about that?
Yeah, absolutely. Because right now it is very scary for a lot of patients. They don't want to leave the house. If you're sick, obviously you're not going to come into the practice. If you have a fever, if you have any of the symptoms of coronavirus or the COVID-19, definitely we encourage you to just do a phone visit, talk with you, get your testing done, get everything done where you're not going to be out in public, where you could spread anything until, we know that you're negative. Everyone has tested negative, luckily, in our practice, and all patients so far for antibodies that I've had. So that's a great thing. But the biggest concern I have is a lot of patients are not getting their testing. They're putting off, their mammogram, or let's say we're watching a nodule on a chest X-ray. We want them to have a CAT scan. They're waiting months to get this done because they don't want to go out in public. Some patients aren't seeing their oncologist, or they're not going to go and do follow-up that they need for conditions that can, even be life-threatening because they're afraid to go out. And patients absolutely need to see their specialist. They need to see their primary care doctor if they're sick. If they have, even their chronic conditions, they need to get these things taken care of. And we do phone visits for anyone who doesn't want to come out in person, but we are open. We stayed open throughout this entire time. So you can come in and actually see us, myself or my nurse practitioner.
So how do you even do a phone visit? Do you have to call your office and say, hey, I want to schedule a phone appointment with you, or Skype
yes.
appointment?
I mean, as long as, I see everybody for their first visit in person, of course, so we can see them, check their vitals, do a regular physical exam and everything like that. But if you've already established with me, you just say, I'd rather do a phone visit instead of coming into the office. We call, we get all the information that we need. We talk with you, figure out what's going on, what refills you need, what testing we need to order. And we just basically do everything except for the actual physical that we would normally do when you come in.
Yeah. And I know a lot of people are thinking, man, what if I don't have insurance? You take cash pays, which is awesome. And a lot of people are thinking, man, okay, I've been insured with my employer for a while. Maybe I'm losing that insurance. Maybe you're new to Medicare, new to Pahrump. There's special enrollment periods. We can actually enroll in health insurance right now. And I can actually get you coverage. If you call my office, Battleborn Financial Advisor, we can help you in taking care of those needs. So there's a special enrollment period with Medicare people through the end of May that you can still sign up and get on either like Humana, for instance, if you want to go on their Medicare Advantage plan to see Dr. Hazlett. We can still enroll you on that plan right now. We can make changes if you're on another plan into that plan. If you are still, maybe you just lost your job at work, we can enroll you through Nevada HealthLink, and you can actually get in subsidies and help you with the cost of your coverage. And we can get you insured like Dr. Hazlett's awesome. She takes actually every insurance plan through Nevada HealthLink. She takes Health Plan of Nevada, she takes Anthem, and she even takes Ambetter. The options are wonderful on there. And I know a lot of people are usually freaked out about the copays that they have to pay about their health plans. And I will say one thing about that is it's better to have some kind of coverage and insurance, so you're not worried about the phenomenally large costs that you can have with medical care. Getting your MRIs done, CAT scans. Yes, sometimes people have large deductibles, but don't make that be afraid to get your healthcare needs met. If you've had some income changes, you're not making as much money as you used to, you might find that you can report that income change to Nevada HealthLink, and you might find your deductibles and cost sharing going down significantly. And that can be a big difference. We don't want to see people not getting the medical care they need. If somebody, especially chronic conditions, Dr. Hazlett, if something like, you have like a lot of heart conditions that come out here, a lot of diabetics,
Right.
Maybe you don't even think you have heart conditions. We talked about it last week about, hey, maybe you're a little bit more tired than usual, and
Right.
maybe you're depressed a little bit right now too with all this COVID stuff. I know I was quite depressed recently. Why would I want to come? It's important to see you. Like, what kind we can do?
Absolutely. And the thing about the copays, if you have Humana Gold, which is fantastic because there is no copay to see a primary care ever. So any patient that comes in with just Medicare and they have that big 20% deductible, we definitely work with them, but we want to get them on something where they don't have any copays. If they go and get x-rays and stuff, it's very low, but a lot of the other plans you mentioned, like Ambetter, HPN, a lot of these only have $7 to $10 copay, so they're very low anyway, which is very good for patients, and a lot of the testing and things are very low as well. So getting on insurance will definitely help, because the cash pay, although we make it very affordable, if we send you for labs, we can get a deal with that too. But if you need imaging, if you need any other testing, that can be really expensive.
And people think, oh, I don't want to be on drugs all the time. I'm tired of all the fact that, oh, I can see my doctor, they're going to just prescribe me a bunch of, oh, here's a pill, go have a good time. We talked last time about this, the fact that you're not a pill pusher. I mean, there's alternatives out there.
Absolutely. Well, I mean, for myself, I believe in natural medicine. I mean, it would be very hard for me to take medication, to be honest with you. I do believe in natural things. I mean, if you get an infection, you have strep throat, you need to take an antibiotic. That's a definite. But if you can do something natural, I mean, even for like diabetics we talked about last week, if you come in, you follow a keto diet, you lose 20 pounds, you can cure your diabetes, not just not just make it better. I mean, you can actually cure it to where you're non-diabetic. I mean, your labs are now non-diabetic. It's fantastic. I've had patients where their A1C is over 10, they lose 20, 30 pounds, they come back, their A1C is 5.5. I mean, that is non-diabetic. Anybody who's diabetic that's listening right now, those are real numbers, and that's not taking any medication. Also, blood pressure. I mean, there's a lot of things you can do with your diet to make yourself healthy.
It's amazing. Health affects everything else too. I mean, I work with a lot of people that, they have the diabetics, their A1C is out of control. They're like 7, 8, or 7.5 A1Cs, and everything gets more expensive for them. The nice thing is health insurance is not more expensive, because we've set up with the Affordable Care Act that we don't charge more for pre-existing conditions or anything like that. But other things become more expensive. You're paying more for insulins. And you're also paying a lot more for everything else. Like, I have a lot of people that come for just even life insurance. So when you think of like, oh, I need to buy life insurance for myself, I might, yes, you're at an increased chance of dying, and therefore it's going to cost you a lot more to even get insurance. And you're like, oh, I need it. I really do need it. But your finances, you just can't even afford even the small amount to leave to your family and to take care of your heirs and stuff like that. It's important that you think about your health and take care of yourself. Do you deal a lot with any mental health stuff at all as well in your practice, or how do you deal with that?
I have a lot of patients that have anxiety and they have depression, and we generally can take care of a lot of it. Now, if certain conditions or depression that's really bad, you need the specialist psychiatrist, especially if you take multiple medications for depression. You need someone to oversee and make sure that they work well together. That can be a little bit more tricky, but for general, just for depression that just takes 1 or 2 items, it kind of helps. But also there's natural things. I mean, you can take a supplement that raises your serotonin and dopamine just like an antidepressant does that has no side effects. So there are options.
Can you talk about that supplement at all? What is
Sure.
that?
It's called 5-HTP. And
Oh,
it's a natural supplement that just it has no side effects. It raises the serotonin and dopamine, and that's the same thing that all antidepressants do, but they all have side effects, and sometimes you can feel worse from the side effects than you do from your depression. So it's really important to try to take something natural if you can, even for anxiety. We have stress tablets, it's homeopathic medicine. You chew up and it makes you feel good. I mean, if you're afraid to fly and you use this, I mean, you don't have to take a Xanax. You can take something where you're not groggy or you feel like you're going to pass out, and you can totally function, but just take that edge off. I mean, there's a lot of natural things you can do.
and you actually carry some of that stuff at your
Oh
your
yeah,
practice
we have
too.
quite a bit because it's very hard to find a lot of these things, especially because we're in Pahrump. We don't have a Sprouts, we don't have a Trader Joe's or Whole Foods or anything here, and also those are really expensive as well. But we have a lot of supplements, and we have CBD as well because I feel like that's a natural, and we have a pharmaceutical grade that we know works. So
We have a
that's an important thing.
we have a phenomenal wellness center in town too, the Pahrump Wellness Center. But we also
Yes.
have we also have your practice too. Where one of the nice thing is too, you feel like you go to the doctor, you feel like you got to go get a prescription, got to go to the pharmacy, wait forever. A lot of stuff you can just go to your practice, you'll carry it there in place and say, hey, let's take this and have it available to you. And then you can also continue to get that prescription at like even the local resources we have here in town too.
Oh, absolutely.
I mean, the reason why I want to do this show is the number one, a lot of people don't realize what we have here in Pahrump. Everybody thinks we got to go to Vegas for everything. And it's like, I don't know about you, but I honestly hate taking an hour drive to go to Vegas every day or hour
the
and a half
traffic.
drive. I mean, I was just there a couple of days ago and I'm just like, just looking for I'm building out an office out there to have some other agents and more people. I'm like, I don't even want to even visit those people. It's just so stressful to be in Vegas. And I'm thinking about Pahrump in our community and just, we have so much. We have wonderful primary care doctors. We have a doctor that even takes natural stuff that when she even carries it in her practice. And we even have these wonderful medical plans that allow us to even see the doctors we want to see here. And we just heard too, one of our specialists, Dr. Eric, is contracted with some new insurance companies even. I mean, they're expanding out their availability to us, making themselves more available to more of the people here in town. And it's wonderful. I'm going to stop us here a little bit. We're going to go on break. But when we get back, I want to talk a little bit more about something really awesome, and that's the weight loss program that Dr. Hayes is part of. A lot of it is actually not insurance-based, but a lot of it is some cash pay and some skincare stuff that she does. But it's phenomenal for us to be able to work in that and to look at other projects. So.
We will return with more Doc Talk after these messages.